Chief Mitchell, 2020 made for a really different year for law enforcement in Lubbock and around the country. We've talked some about, you shared with the council some of those stats. Tell us a little bit about our experience in 2020 and how we're preparing ourselves for 2021.
Yes, Lubbock, being a city of over 260 some odd thousand, much like major cities across the United States, experienced a rise in violent crime. We pretty much mirrored what we were seeing across the United States, in that our violent crime in regards to the categories of homicides and that of aggravated assaults, in which a suspect took some type of weapon and used it to assault someone else or kill someone else, we saw increases in both of those categories. Unfortunately, here in Lubbock, in the category of homicides, we doubled what we normally see here in Lubbock. We average somewhere around 16 to 26 homicides a year. Last year we averaged, we had 41 incidents of homicides, and that includes 5 incidents in which there were vehicular manslaughter charges filed on someone speeding, going 50, 60 miles over the speed limit, going through an intersection or racing and killing someone. What I like to do is I like to take a deeper dive into those incidents to find out what's going on and how could we impact the reduction in those specific crimes. And much like we see across the United States, a lot of our victims had some type of connection or some type of relationship with their assailant. Domestic violence led by far all categories here in Lubbock, in which either a loved one, a brother, a father, took the life of someone they love. And we had a couple of neglect cases in which you had children under 2 years of age who lost their lives at the hand of their caregiver. So a lot of those cases, it's difficult for us to be in that situation at that particular moment, especially when it comes to domestic violence, because those are a lot of crimes of passion. The other categories that we saw that were really led us here in Lubbock were that there was a narcotics transactions in which the victim agreed to meet someone to buy drugs or sell drugs, and something went wrong. And the other category was disturbances or disputes between individuals. And again, a lot of these cases were those in which there was some type of relationship. The victim knew their assailant. So from a law enforcement and crime suppression standpoint, you look at each of those types of crimes and see how could we have interceded in that. Our crime suppression, we served over 302 warrants on individuals last year in regards to narcotics dealings and just crimes altogether. So when I look at it, our goal is to increase our crime suppression efforts, increase our patrol efforts, to try to continue to reduce those amounts of crimes. But also, just like I communicated to our public earlier in the year, if you know someone who's in a difficult relationship, we rely on you to help that person get out of that relationship. Guide them to us, and there are plenty of agencies out there that will help them get out of those difficult relationships when it comes to your husband or your boyfriend or something like that. And we had a couple of incidents last year in which our young people, killed their girlfriend and then committed suicide. So all of these situations, someone that knows these folks needs to help us be the intercept. Identify what's going on, guide them to the social services that are available to help them get out of those relationships or to help them work through their issues.
Chief Fogerson, the pandemic changed the way first responders went about their business. Talk a little bit about that and what you guys learned from that.
It certainly did, and almost immediately. For us, it was an unseen enemy. All viruses are unseen, but the problem didn't reach Lubbock until it had hit other parts of the country. We knew it was coming. We knew we had to start preparing now, start changing our policies and procedures, just to reassure everyone that we were going to be prepared. But we had to let our troops know that yes, this is coming. and we need to be ready for it. There were several things that we had to do. At the very first, there was a shortage of PPE. So there for a while, and it wasn't a problem with our vendors, it was a problem of availability. The vendors couldn't even get it. So we couldn't get it through our normal channels. We began to make our own PPE. There were several vendors and companies and organizations throughout Lubbock that began to make us face shields. We made our own aprons, our own gowns to protect ourselves, and we did it out of Tyvek's house wrap. We would buy it in 500-foot rolls and stamp our own gowns out of there. So we had to get really creative. Other things, we usually send 4 people in on a medical call because that's how many it takes to work oxygen bottles or to do CPR. But we had to start limiting exposure. So we would send 1 person in as a scout to let the others know exactly what was needed inside, because there was no need to expose 4 people when we could get away with just exposing 1. Now, if they found an issue inside where we did need 4 people, we'd send the rest of the team in.
Catherine, 2020 began with you being a relatively anonymous director of the Lubbock Health Department. And by the end of 2020, you became a local celebrity. And I say that with all due respect. But what you were prepared for the health department prepares for things like a pandemic. So talk about from a health health professional, somebody that does what you do for a living. How did you guys swing into action, and how did you continue through the year to shift and to add? And because you made a bunch of changes through the year.
Yeah, and I think the best thing that prepared us first was our health department staff on their own actually went out for a certification called Public Health Ready, which is a national certification. We completed that in October. That certification has us review our plans, such as setting up a pod site, how to do large lots of contact tracing. So we were
October of 19?
October of 19.
Okay, right before. Okay,
And we actually got the award in January, right as we were ramping up the planning for COVID-19. And, we started talking about that in January of 2020. We were having staff meetings, going through the what ifs. If this gets to Lubbock, what would we do? How would we handle our first case? And then from there, we started realizing that this really was coming, starting looking at, just doing 1 case investigation is not going to be enough. How do we do 100? How do we do 1,000 case investigations? What kind of measures, what kind of education needs to go out to the community? And it's just being fluid and being able to change and pay attention to what's going around nationally and what's needed for our community to control the spread of the virus.
This spring, or this winter and spring, your business has shifted to bringing hope through the vaccine. But you guys vaccinate all the time. Talk about how you mentioned a pod a minute ago. First of all, what a pod is, and then how you scale up to do mass vaccinations.
So a pod's a point of distribution. So an area where we can give out a lot of vaccine or medication if it's needed. Scaling up really takes the entire community. We've been relying on police and fire, admin support from the city, but it's taking that, what we do normally for a vaccine clinic, how do you vaccinate 50 people in one morning, to enlarging that to how do we vaccinate 2,000 people or 2,500 people in one afternoon. So really just looking at how to ramp up, how to scale, how to ask for help, how to bring in other groups to assist us.
Chief Mitchell, let's talk about 21 for a minute. Lubbock Police Department celebrates a big birthday. Talk a little bit about that. Talk a bit about this community policing, more of a neighborhood policing model that we're moving to. And Brad, catch us up a little bit on your substations. There's a lot going on in your world.
There is a lot going on. And, just being over here in Lubbock for just over a year, one of the things that I did when I first came in is really try to learn a little bit about the history of Lubbock and its police department. And in reading up on some of the history of Lubbock Police Department, it was obvious to me that, hey guys, this is our 100th year anniversary is coming up. And everyone was like, what? I said, you guys don't celebrate your anniversaries, like your 25, 50th, 70th? It's like, well, no, we've never done that in the past. And it was something that I was used to doing in my previous department. I was like, this is huge. This is 100 years of being a police department and having a chief of police, designated by the commission at that point in time. So I wanted to really start talking about what that was going to look like and how we were going to celebrate it. And I don't have my badge on now, but we have a 100th anniversary badge that all the officers get to wear for this year. And then at the end of the year, you have to retire it and go back to our traditional badge. Our media relations department is going to have several different things throughout the year to celebrate our 100th year anniversary. And it coincides with the opening of 3 of our patrol division stations. The opening of our patrol division stations, again, it was something that, really took place several years ago before I got here, but we're starting to see the fruition of that this year. The first one that's going to open up is going to be East Patrol Division, and it's going to open up in late June or early July. And again, that's going to kick off with a celebration. We hope we're all behind COVID at that point in time, so we can truly have a celebration with our community, and especially with the folks in these individual neighborhoods or communities that are going to have subdivision stations, so everyone can join in that fun. What 2021 looks like for us from a policing standpoint is really exciting. We are going to fundamentally change how we deploy and police from a patrol standpoint. For the last 100 years, Lubbock Police Department has traditionally policed out of one facility, the police headquarters downtown. Moving forward, you're going to have 3 patrol division stations embedded in those communities throughout the city, and they are going to be the central hubs for those geographical divisions or that landscape there. And the goal is to, one, have a place within that community to where people know they can go, they can be a part of. Those police officers are theirs, take ownership of those police officers, and for those police officers to take ownership of that geographical piece of landscape. And that should truly increase our community policing efforts and build those bonds, because that's what we're looking to do, is build the bonds between law enforcement and our communities so we can work together to solve all of our problems, whether they be violent crime, property crime, or just social issues.
Chief Fogerson, when you presented to the City Council late last year at a planning meeting about the community's growth and how you keep up with that, talk a little bit about what I think we'll call Fire Station 20. Is that right?
Absolutely. Fire Station 20. We're constantly analyzing trends in response through all the geographical areas of the city and fine tuning. How can we get there faster? How can we provide a better service? How can we be more efficient? So what appeared to us early a couple of years ago is the incredible growth out, in far southeast Lubbock. And we start to look at times. We look at the amount of calls, what types of calls they are, how close does a responder need to be to that general type of call. And it indicated to us that it was time to add another station just to provide the best service we can.
Chief, you and your folks at Lubbock Fire and Rescue have been sort of connected at the hip to Ms. Wells and her team, in a lot of ways. Talk a little bit about that. What's that been like for somebody who signed up to be a firefighter to find yourself really on the front lines of fighting something different, fighting you said a while ago, something we can't see, a virus. What's that been like?
Well, first off, I'd like to thank Catherine. I mean, it's just been great. The relationship that we've formed through this has been very rewarding for the fire department. Just to be able to contribute in a new way that maybe we've never imagined, to be part of the community's battle against COVID, to a return to normalcy, so we can all go on about our lives like we were back in 2018 and 19. We looked early on at trends that were going on around the country, how other departments were finding ways to help in the areas where the virus hit first. And we copied those. We listened to what other fire chiefs were saying around the country and what other needs were cropping up. The first thing was testing. The fire department being a large labor pool that is medically trained, we very adaptable to the testing process, so we need to get involved with that. And then the state reached out to us and asked that the fire departments begin to test nursing homes, because that was an emerging trend in where a lot of the sickness was going on. So once we got fairly good at that, we moved on to contact tracing. You test and then you trace. And it's evolved now to where we're doing vaccine distribution and vaccination. And it's something that falls very naturally within our scope of practice. And we've just been very happy to contribute, and we'll continue to do so.
Catherine, Chief talked about it, but I think on behalf of all of our citizens, we just a real heartfelt thank you to you and your team. We've been on a lot of Zoom calls together the last year.
Yes, we have.
And there have been a few of those days late in the afternoons, sometimes on the weekends, that I just wished I could have reached through Zoom and put my arm around you and said, it's going to be okay. Because there are times when I felt like the weight of the whole community was on your shoulders. So thank you for that. I want to talk, though, about something a little different. You're going to have a new home sometime in 2021 or maybe early 2022. Talk a little bit about that. I think it's exciting and give you a chance to share some news with people.
Very excited that we're going to be building or refurbishing a building for the health department. It's going to be located in central Lubbock, which I think is a great place for us to be as a department. The department's grown significantly. When I started, there was 11 staff, and even not counting all the contact tracers and the temporary staff, we have about 45 full-time staff at the health department, and we need a home. We're starting to add lots of programming. We've actually added substance use disorder services this year. We've added community health workers. So lots of exciting other programming besides COVID.
Mental health,
mental health. Yeah. So we, want to be that community partner. We want to be linking groups of individuals together. We want to be addressing some of our disparities in our community, really working to reach those most vulnerable citizens. And I think with a new building, it will be somewhere that's open, somewhere that we can offer services to the community in a place that they deserve. Our building's very run down. It doesn't have the space. No parking. So we're just excited to have that and, space for future growth, future innovation.
Okay, so as we start to wrap up, I think as leaders, we always reflect on what we've been through and think about what we've learned. So what did you learn in 2020? What will you always remember about 2020? Chief Mitchell, let's start with you.
I think one of the big things is the resiliency of not only the men and women of the Lubbock Police Department, but throughout the city, in every department. A lot occurred to the men and women who are employed with this government entity last year. And to see them face every challenge, whether it is the loss of 2 first responders and how we responded to that as a city, not only as a government entity, but as the citizens and how they responded to the loss of 2 of their own as well. Then you hit them with a pandemic that is overarching for the entire world. And how do you respond to that? And just to see the tragic number of deaths that have occurred throughout the world and here locally at home, the resiliency of the men and women here and across the United States, it gives you hope of we can conquer anything that's thrown our way.
Chief Ferguson?
Well, I'd certainly echo the part about resiliency. I've also learned there's no limit to the amount of ingenuity that our people have, the people that work for both the police department and the fire department and the health department. It's just been really impressive the way everyone's adapted and the way everyone's come together and the way they've said, we're going to find a new way to serve, no matter what that looks like, and we're going to come together and just get it done.
Catherine?
And I have to reiterate what both the chiefs said. I have found so much strength in our health department and the staff that we've had there. Everybody in the department has taken on a leadership role and has tackled things that they have never had to tackle before. Just that they continue to have hope, that they continue to show up to work every day. It's been a tough year. They've dealt with a lot of tragedy, a lot of stress, and I haven't lost a single employee. They've all keep coming to work every day, and I'm just proud of them, and I'm just proud of the city for coming together and helping us.